Over 1.3 billion people around the world have high blood pressure. In the United States, more than 1 out of every 2 adults has hypertension, and many don't even know it. Because high blood pressure doesn't usually cause symptoms, we call it the silent killer. Hi, I'm a practicing physician and a clinical professor of medicine at a major medical school. We are here today to talk about high blood pressure, also known as hypertension. Let's cover the basics of high blood pressure, how it's diagnosed, why it's dangerous, and what you can do to prevent and treat it. The American Heart Association defines normal blood pressure as less than 120/80 millimeters of mercury. When the top number or systolic blood pressure is between 130 and 139, and the bottom number or diastolic blood pressure is between 80 and 89, we consider that to be stage 1 hypertension. And when the top number is 140 or higher, and the bottom number is 90 or higher, then we call that stage 2 hypertension. These numbers represent the millimeters of mercury. So let me show you a chart from the AHA. This shows the classification of blood pressure according to those measurements. When your blood pressure gets really high, it can be life-threatening and requires emergency care. That would be a systolic blood pressure of 180 or higher, or a diastolic blood pressure of 120 or higher. At that point, we call that a hypertensive crisis. If you ever see these numbers on your blood pressure monitor, go straight to the emergency room or call an ambulance. But what exactly is blood pressure? To understand blood pressure, you need to first know a little bit about your heart and blood vessels. Here's a picture of the heart and great vessels. Your heart pumps oxygen-rich blood through your arteries all around your body to deliver oxygen and nutrients to your organs and muscles. The main artery that comes out of your heart is called the aorta. When your heart pumps, it sends blood surging through your arteries. With each heartbeat, some of that force is exerted against the walls of the arteries. That force is your blood pressure. Let me show you a simple illustration of what that looks like. This is your artery, and this red line represents your blood pressure pushing up against the arterial wall. The higher the blood pressure, the more force that's pushing up against the arterial wall. When the blood pressure is too high for too long, it can damage the inside layer of the arteries. That makes them narrow, and that causes your blood pressure to go even higher. Higher blood pressure also causes the kidneys to release more sodium into your urine. That can lead to dehydration, and that can drop the blood volume. But your body will sense the drop in blood volume and releases a hormone called aldosterone that makes your kidneys reabsorb more sodium back into your body. All of that ultimately leads to atherosclerosis, where you get hardening of the arteries and narrowing of the arteries. That can cause blockages in your arteries. And if it blocks an artery that supplies blood to your heart, you can have a heart attack. If it blocks an artery to your brain, you can have a stroke. And if it blocks an artery going to your leg, you might get an intermittent claudication, which means pain when you walk. Okay, now that you have a better understanding of what high blood pressure is, let's talk about what causes it. First off, blood pressure rises as we age. People who are overweight or obese are more likely to have hypertension. Also, eating lots of sodium and not enough potassium increases the risk of hypertension. These are called risk factors. Other risk factors include heavy alcohol use and smoking. We also know that genetics play a role in high blood pressure. Stress and anxiety can raise blood pressure. And people who have chronic kidney disease or diabetes are at increased risk of hypertension. In most cases, there's no one single cause of high blood pressure. It usually results from a combination of risk factors. Now let's look at why high blood pressure is so dangerous. High blood pressure is dangerous because it often doesn't cause noticeable symptoms, yet it works silently and steadily to damage the heart and blood vessels. That damage increases the risk of serious health problems such as stroke, heart attack, heart failure, and kidney failure. It can also damage blood vessels in the eyes, and that can cause vision loss. High blood pressure that lasts a long time can also cause the arteries to become very stiff and harden, which increases the risk of other problems. According to the Centers for Disease Control, high blood pressure contributes to nearly 700,000 deaths in the U.S. each year. That's about 2,400 deaths every day. Now let's talk about how high blood pressure is treated. The good news is that hypertension is preventable and treatable. Let's talk about the steps you can take to prevent and treat high blood pressure. First, you can make some lifestyle changes. You may have heard of the DASH diet. It stands for Dietary Approaches to Stop Hypertension. The DASH diet is rich in fruits, vegetables, whole grains, lean protein sources, and low-fat dairy. It's a balanced, healthy way of eating that can help lower blood pressure naturally. Another thing you can do is exercise regularly. Aim for at least 150 minutes of moderate intensity aerobic activity each week. That could be brisk walking, swimming, or biking. Exercise helps keep your heart and blood vessels strong and healthy. Another one is reduce your sodium intake. Cut back on processed foods and fast food. They often contain high levels of sodium, which can raise blood pressure. Instead, cook more meals at home with fresh ingredients. You want to avoid foods that are high in saturated and trans fats. These unhealthy fats can contribute to clogged arteries and increase the risk of heart disease. Next, quit smoking. Smoking damages your blood vessels and makes blood pressure worse. It also increases the risk of heart disease and stroke. And finally, stress reduction techniques such as yoga, meditation, or deep breathing exercises can help lower blood pressure. Medications are another important part of treating hypertension. There are several classes of drugs used to treat high blood pressure. I'll tell you the names of some of them and how they work. First, ACE inhibitors. These drugs end in the suffix pril. Lisinopril is a common example. These drugs help relax your blood vessels by blocking a substance that makes them narrow. Blocking that substance lowers your blood pressure. Another class of drugs are angiotensin receptor blockers. They end in the suffix sartan. Losartan is a common example of an ARB. These medications also work to relax your blood vessels. A third class of drugs used for high blood pressure are diuretics. Common diuretics include HCTZ, hydrochlorothiazide, and chlorthalidone. Diuretics make you urinate more. That reduces the fluid volume in your body and therefore lowers your blood pressure. Another class of drugs are the calcium channel blockers. They help your blood vessels relax by blocking calcium. One common calcium channel blocker is amlodipine. No matter what medications you take for hypertension, remember to never stop taking them without consulting your physician. You should also check your blood pressure at home every day. Get a good home blood pressure monitor and learn how to use it properly. Then record your readings in a logbook. That way you can watch your blood pressure numbers trend over time. Share that log with your doctor at your visits. As promised, here are the references and resources that were used in this video. I hope you found this video informative and useful. Please share any questions or comments below. And please subscribe to our channel for future medical education videos. Our next video will focus on low blood pressure. Check it out. Thanks for watching. I'll see you next time.